Well, I'm joined in studio now by a man who'll be familiar to many of you from the COVID pandemic. He's the Deputy Director General of the World Health Organization, and he's also the main speaker at the Child Poverty and Wellbeing Summit today. Dr. Mike Ryan, good morning to you.
Good morning.
We were just saying it's very odd to be sitting here with you in person. We've done so many interviews with you down the line, remotely from our homes during COVID. You were such an important voice to so many people today, but you're here today talking about child poverty. What's your message?
Well, first of all, I'm really glad to be able to come here. It's going to be one of my last acts as the Deputy Director General before I leave WHO, and nothing is more appropriate than doing that in my own country, but more importantly speaking about children, speaking about what is our greatest natural resource in this country or any other country. And after 30 years at this, we still, as a global community, fail to see that. We fail to invest in our children. We fail to see that the most dangerous thing to our civilization and society is someone with nothing left to lose, and we're leaving a lot of children behind us with a lot lost.
And in Ireland, 1 in 5 living in poverty when housing needs are taken into account, 5,000 plus on the homeless list now. The figure goes up and up and up the whole time. That's a sorry record, isn't it, for a rich country?
Yeah, and that's the thing. We talk about poor countries and we talk about least developed countries, and we talk about ourselves as industrialised, high income, or most developed countries, what a euphemism that is. And we saw that in COVID. We saw the impacts of poverty within societies, not poverty between societies, and the impact that had on outcomes in COVID, the impact that has on educational achievement. And that's the reality, is poverty is everywhere. The one thing I will say, and why I'm very glad to come over here, is that at least I see a government trying to deal with that in a multidimensional way. I see a government trying to at least recognising that the challenge is cross-sectoral, that there needs to be universal approaches to reducing poverty, but with children you need to target that. And we need to do that in Ireland right now. We need to set aside, continue
Is that
to
an
do
argument for more targeted benefits to tackle child poverty?
However you
in the
do
budget?
that, through social workers, through targeted programs, through targeting financing. Yes, we need to do the universal measures, and it's I'm a product of that system. I don't think I'd ever have got to college. I don't think without being free access to medicine, free access to dentists, our free education system. We've done this before as a society in the 1960s. We realised we needed to educate a new generation. We needed to change what we did. Sean Lemass, T.K. Whitaker, and so many other people did that. Our society, all of us sitting here, we're products of that system, but we didn't finish the job. And we're leaving behind, as you said, 1 in 5 children in this country. And yes, we can do it through universal means of improving income, but poverty is not measured just through the bottom line of euros in your pocket. There's poverty of environment, there's social poverty, there's exclusion, there's isolation. We have a mental health crisis very often amongst our youth. So we have to look at this in a much more multidimensional way and create an environment in which our children can thrive, a financial environment in which they thrive, a social environment in which they thrive. And I think the government is trying to do that, at least for what I see, ministers coming together at the highest level today with all of the people who are working across the sector to try and at least identify where to go from here. But as Eisenhower said, that he hated plans, but he thought planning was essential. There's too many plans. I could show you plans in Geneva that are holding up doors. You have to move and execute our plans. We have to implement, and we have to be accountable for the implementation of those plans. And I think there's a sign here that government and the NGO sector and others, and those people who serve communities, we need to ask children what they need. We need to invest in those communities that serve those children.
And in talking about children, and of course you are very much to many people the voice and face of the lockdown, we relied on people like you for information and guidance. It's thankfully in the rearview mirror at this stage. But more and more questions being asked about the price that children paid. That the impact of lockdown on children in particular, we're only now beginning to see the impact on educational outcomes, on health outcomes. As you finish up, I'm sure you've been looking back. Did children pay too high a price for lockdown during COVID?
It certainly had a massive effect on children, again, just to be clear from our perspective in WHO, we never advised lockdowns. Lockdowns were a construct that countries themselves came up with. We always advise targeted measures that will allow you to reduce transmission while keeping society moving forward. At no point did we advise lockdowns. I think if we look back...
The closure of the schools in particular
and that
seems to have been a huge issue, and very many questions now being asked as well about, the lack of contact through social care and so on with children.
But there was a huge obsession with asymptomatic transmission, and the virus is there and it's everywhere, and we need to keep children safe. And
people used to say children are vectors, isn't that right?
And frankly, when you look back at the data, that's certainly not supported in the evidence. And I think if there was one thing we've learned in COVID was, I think closure of schools was there were certain circumstances where you had massive overwhelming disease in hospitals, people lying in corridors, and there was a need to shut down society as a whole, but in a targeted way, in a town, in a village, in a county, wherever, and that was all over the world. But this blanketed lockdown for weeks and weeks and weeks, where children couldn't access school, I think that had a hugely detrimental effect. And the benefit of that, specifically of closing schools, has not been clearly demonstrated. So I think you're right, Anya. I think that's an area that needs to really be looked at. But, when the next pandemic comes, and it will, the virus will be different. So let's not play out the next pandemic.
No, and don't base your plans on apples and oranges.
Exactly.
And the fact that
what it does say is you need to be flexible.
The other thing that, and COVID, we're now sitting in the same room, all talking to each other again, travelling on public transport, going to school, because the vaccines came along. But with the vaccines, of course, came an awful lot of controversy. We have the RFK of it all, the Robert F. Kennedy now in the United States, and the moves against vaccinations there. The rejection of mRNA vaccines in particular. We have Florida stopping child vaccinations. What do you make of the anti-vax movement that was also the result of COVID?
Yes and no. Anti-vaccination was there before COVID.
It certainly got amplified. It's absolutely different.
Stratospheric, for sure. My position on vaccination is my position on all drugs, is that human beings have a right to question anything that's put in their body. Rational skepticism, questioning, why am I doing this, what's in it, what's it for, what are the side effects. That's very important, that we don't take that right away from people, and that we give people the knowledge that they need to make informed decisions for their families. So therefore, the idea of hesitancy, being hesitant to do something that may have life-changing consequences for good or bad, is very important. But when that turns into anti-vaccination as an ideologic concept, where people are being manipulated with false information around a vaccine or around a given intervention, vaccines have saved more lives on this planet than any other intervention ever in the history of our civilization. Hundreds of millions, billions of children have been saved over time. Let us go back and think about children choking to death with diphtheria in the 19th century, polio in the 1950s in Ireland. Go back and ask those people about vaccination. Ask those mothers and fathers, as they watch their children die under 5 years of age, what they thought about vaccination. So I think we are in a period where we need to question everything. It's very important that we have a healthy debate, but we also need to trust science and trust when the data tells us that these are safe and highly effective interventions. So I hope people in Ireland have continued their faith in vaccines, and the overall confidence in vaccines in Ireland is very high, and I hope to God that continues.
Talking about children, probably the most vulnerable children in all the world at the moment live in Gaza, where so many have died in the war there. Absolutely. Organisations like the World Health Organization, the United Nations, helpless. We stand by and watch on, and the aid is piled up at the border and can't get through to them.
Yeah, well, anyone who's heard me speak in the last number of months or years knows my view on this. I'm apoplectic. I'm almost entirely disillusioned with the world on this particular point. We're standing to the side and literally abandoning the men, women, and children of Gaza, and WHO is struggling still to get medical assistance in. There are thousands and thousands of children with spinal injuries, with amputation injuries. We're struggling to get people medically evacuated. We are being impeded. There are certain crises in which, the circumstances, the logistics, the situation is such that it's very hard to get assistance through. You're fighting nature, you're fighting other things, logistics. In this situation, we're not. This is a tiny area, a small area that's easily accessible from multiple countries, and yet we can't even get basic assistance. The children of Gaza are being intentionally starved as a weapon of war. I'm not an ideologue, I'm a humanitarian. And from WHO's perspective, we should not stand by and let this happen. Hostages need to be released. There needs to be a ceasefire now. And how many times can we say this? Although I have to say, in Ireland, I must commend the people of Ireland, the NGOs, the government and others. I mean, the way in which the Irish people have stood with the people of Palestine has been remarkable. And I think it's the spectres of hunger and occupation. Those two words are cultural triggers in our society. I just wish to God they were triggers in other societies, because the Irish can't do it alone.
It almost feels trivial switching from such an important topic to my final question. But anyhow, your name was linked with the presidency at various stages. I think the Labour Party in particular were interested in talking to you, did they?
They did.
Anyone else?
A number of people talked to me, but I'm very good at dodging bullets.
Dodging a bullet? Well, you're retiring on Friday, and you're well set for it.
No, I think I'm a great fan of the presidency, and I've seen people like Mary Robinson and Mary McAleese and Michael D. O'Higgins, people who I admire greatly. To see people lead our country and represent our country, and while I'm very proud of my own achievements, I don't think I sit amongst those exalted people. I just hope that Ireland makes the right choice and that we don't turn this election campaign into some kind of, sort of breaking people down, because it's the only chance we have to throw stones at an individual. I just hope we use this election to reflect on and reaffirm who we are. It's like reaffirm who we are when it comes to our children. These are the values of a society, and I think the president represents the values that a society has, not the politics. And I just hope whoever is elected can continue to do the work that President O'Higgins and many wonderful presidents before have done.
So you're not heading to the Euros. You are retiring on Friday. What are you going to do next?
Retiring maybe too hard a word. I feel like an aging rock star. I think I have one more. I think I have one more tour left of me if I can rest for a while.
The comeback tour, yeah.
Yeah. No, look, I've lost many people in my time, and last year we lost Aidan O'Leary, who was the director of polio, and he was a hero. And to lose him in seconds, it really made me think about my family, my future, where I was going, because I thought he was bulletproof. It's a year since he passed, and others have passed, and eventually you say to yourself, you know what, I'm not immortal, and I need to take time to recover and then see what I want to do when I grow up.
Well, we look forward to hearing from you again at whatever point in the future, and the best of luck to you, and thank you for coming in to us. Dr. Mike Ryan from the World Health Organization. It's 8:25.